Cars began lining up at the Dixie Regional Medical Center around 10 a.m. as volunteers portrayed sick victims of a worldwide pandemic flu.
I am very sick and I am very, very scared. Both of us are scared.
I'm having a hard time breathing. I've been traveling. I'm here without anybody, and I have asthma. So
for this one, pandemic means new influenza virus that's never been seen before. There's really not a lot of things you can do about it.
The 5-county drill is part of a public health test to find out if emergency personnel would be ready in case of the real thing.
We only have a limited amount of beds in the hospital, which we are already at full capacity. So we can't admit everyone like we would normally do in a normal day.
I have a sore throat, a cough, body chills, fever of 102, and then really bad body aches.
This is Colleen Campbell. I need a medical bed.
I'm a 29-year-old female, and I have a roommate who can take care of me at home.
Healthcare workers would assess those coming to the hospital using triage guidelines that have been in place since 2009.
I like to help my community out a lot, and if they needed me in an actual emergency, I'd be trained and able to do it if they called me.
While this pandemic drill wasn't bad enough to quarantine its victims, it did take away lives. In Washington County, those people who didn't gain access to the hospital were sent to the St. George Library to receive instructions on how to care for themselves at home.
someone to care for you at home?
I do. I have a partner, and her name is Myrna, and she's going to take care of me. My first patient was 88, and so according to protocol, anyone over 85, they wouldn't admit or basically be treated. They'd be treated at home, so he would eventually die.
In the influenza, the Spanish flu of 1918, many of the people who passed away just because they didn't have food and water. People were too afraid to go into their house because people had the flu. And so in that booklet, it explains a lot how to care for someone who's sick, how to prevent getting sick yourself, as well as how to care for someone who's dying.
You got turned away at the hospital.
I did. I got sent. They assessed me and said I was doing pretty good. Gave me a paper with all the instructions on it and sent me home to rest.
So there is a vaccine for this epidemic. The United States government is bringing in that vaccine into our county, but until that time, the best thing that you can do right now is to not congregate, not mix with other people, because that's how the disease is spread.
In a real emergency, the 911 dispatch system would also be inundated with calls. Those calls would be funneled through to the appropriate care in order for emergency personnel to continue to handle their day-to-day operations.
Most of the time for this type of thing, they're going to be directed to stay home unless they're severely ill. Then they're either be transported by ambulance or they're going to transport themselves because they're not able to get an ambulance service there because it's overwhelmed.
I've got all kinds of disease. I'm vomiting and I'm sick and I don't know what to do. I'm dying. I'm living alone and nobody's helping me.
It'll just be chaos, and it's important to just be prepared.
There were about 330 volunteers along with 60 to 70 partner organizations participating in the 5 county-wide drill.
We're grateful to be prepared in our community and want to know and help so that in the event of an actual emergency that we would be ready to help.
And so this is a good opportunity where we can sit down, go through a scenario, look at the issues that came up, some of our weak spots, and then go back and correct those weak spots.
Each county set up their EOC or Emergency Operations Centers and managed resources for the medical emergency. And in a real event, the media would also play a critical role in disseminating information to the public through social media, TV, and radio. In St. George, Melissa Anderson, KCSG News.